One of the things that I am most passionate about right now is medically necessary contact lenses. And what medically necessary contacts are people that have a problem or a disorder where normal eyewear will not give them good vision acuity, such as glasses or contact lenses. Normal ones just don't do the trick anymore. And that's usually caused by a problem in the cornea. And that's this dome, this clear dome that covers the colored part of the eye. And so with people with a disorder, this will be misshapen for some reason. It's usually this nice uniform shape, and we can put glasses, lenses, or contacts over here, and we get the vision that they need. But if it's misshapen, it doesn't matter what we do on top, we just don't get the vision. Disorders that'll cause that are like keratoconus. That is a genetic problem that people start to develop in their late teens or 20s. People that have had scarring, folks that have had cornea transplants, sometimes that cornea, that new cornea is not shaped very well. Actually, I've had quite a few people that have had mishaps on RK surgery or LASIK procedures that didn't go quite right. Cornea surgeries to correct their vision, and now their cornea is misshapen now. And after several attempts, now they're really misshapen. And so they just don't get the correction. So what has been developed is scleral contact lenses. And basically what it is, it's a gigantic contact, kind of like this, maybe not quite this big, but it kind of shows the idea. And basically what you do is you fill the dome here with saline solution, and when you put it on the eye there, that saline solution stays in there, and you're creating a new optical surface. So if that cornea is misshapen, all the saline fills in for that, and now you've got a nice smooth surface. When we're fitting these on patients, it really makes a huge difference in their life. These are people that have been running around with the best correction they could get is maybe 20/60 or 2100 or 2200. Legal driving is 20/40. And ideally, we'd like them to be a lot better than that, and they would as well. And so when we fit these lenses are able to give these patients 20/20 vision in a lot of cases, or 20/25, or a whole lot closer to 20/20 than what they've been dealing with. And through this process, I've done this, I don't know, hundreds of times on patients, and just about every single time a patient usually says during the process, "I don't think you realize this changes my life." I had one patient that I'll never forget. He had corneal scarring from a car accident he had when he was 16 years old, and he's in his 40s now. And his best correction in that eye was 20/80, 2100. And we put the scleral contact lens on him for the first time, and he was walking around the office, and tears kind of came to his eyes, and he said, "Wow, you don't realize this changes my life. I can now get my CDL license." So that just doesn't just change his life, that changes his family's life, because he can get a better job now than what he had before. And it never gets old fitting these lenses and changing these people's lives the way it is.